No, an antacid is not the permanent solution for GERD, which is gastroesophageal reflux disease. Hi, I'm Dr. Raghu D K. I'm a consultant gastroenterologist and hepatologist at Apollo Hospitals, Jubilee Hills, Hyderabad. So one of the common questions that I keep getting from my patients is heartburn and GERD the same, and is the management the same? So just to start off with, heartburn is nothing but acid reflux, or the gastric acids regurgitation or reflux into your food pipe or the esophagus. That usually happens when the valve at the junction of your esophagus and your stomach relaxes more than required. It's common to have heartburn. Everyone has heartburn at some point in their lives. But when this heartburn becomes more frequent, when it happens more than a couple of times a week, or it does not respond to medications, or after you treat them with medications, it subsides and it keeps coming back, that's when you have a condition called GERD. And that's what needs to be concerned, and that's what needs to be managed on a regular basis by an experienced or a trained physician. So you need to know that subtle difference between heartburn and GERD. So when do you actually get concerned about GERD? When you have a certain alarm features. What are those alarm features is what you need to know. Some of the alarm features are not just having run-in-the-mill acid reflux or regurgitation, when you have difficulty swallowing, when you have black-colored stool, when you're losing weight, when you have early satiety, which is you feel full as soon as you eat a certain amount of food, when your abdomen is bloated, when your blood shows that you're anemic, your blood counts are low. All these are alarm features. When you have hoarseness of voice as a result of persistent reflux or GERD, all these are alarm features to tell you that you need to consult a trained physician to find out more about this GERD condition. Another myth that everyone talks about: are medications the only way to manage GERD? No. First, you need to find out why you have the GERD. Do you have certain medications which, as a side effect, are causing you the gastroesophageal reflux disease? Is your diet a cause for your GERD? A simple fix of your diet. Are you overweight? Do you have a hiatal hernia that needs to be fixed? There's several reasons why you can have acid reflux, and also in your stomach. You could have a hyperacidity or acid-producing condition that can predispose you to GERD. Do you have an infection inside your stomach with Helicobacter pylori bacteria? All these need to be taken into consideration before saying that is medication the only way to treat GERD. Very simple, certain lifestyle modifications like, avoiding going to bed for at least 1 to 2 hours after having a heavy meal at night is one of the ways to fix without medications. Sleeping on the left side rather than sleeping on your right side, because the greater curvature of your stomach sits on the left side of your belly, so that helps in relieving some of your acid reflux. Avoiding medications or avoiding smoking or alcohol, which tend to relax the sphincter at the junction of your esophagus and your stomach, is one easy way to fix acid reflux. Avoiding a heavy meal before going to bed. Avoiding fried fatty food or saturated fats at night before going to bed. All these can prevent acid reflux on a regular basis rather than just using medications for a prolonged period of time. So no, medications are not the only way to treat acid reflux. There are several non-medical ways of managing acid reflux.